Root tip removal refers to the surgical removal of the root tip from the tooth root. Chronic inflammation of the root tip will eventually, unfortunately, necessitate surgery. Let's take a moment to investigate how this chronic bone inflammation happens. In the animation, you see how deep caries, or bacteria infecting the tooth nerve, cause you to experience pain, resulting in necessary root treatment. The dentist carefully removes the infected tooth nerve material, which is also known as endodont, and then finally seals the canal with a special material. If the root canal, as seen here in the video, is not cleaned thoroughly and filled properly, remaining canal bacteria may lead to chronic bone infection. If the root treatment is in fact performed correctly, but the tooth is only filled with a simple filling, for example amalgamate, the filling may develop leaks over the years, and this in turn allows undetected bacterial invasion in the tooth interior. Root tip inflammation is a probable consequence. The patient often does not feel a bone infection itself for some time, up to a few years. A relatively late symptom is a hard swelling and/or a fistula on the gums, as seen in this picture. If the bone inflammation is not significant, repeat root treatment, called a revision, can sometimes promote healing, provided that the root treatment is carried out under hygienic conditions. If the root treatment revision does not lead to the desired result, or if the infection is already too large, the surgical cleaning of the so-called focus, also known as a root tip resection, is usually the last option. Root tip cutting alone, without interior tooth cleaning and filling, cures the pain in the short term, meaning acute symptoms will disappear. But this does not cure the cause of the pain, and your problems will reoccur, often in just a few years. Root tip resection with orthograde filling refers to the surgical removal of a root tip and the cleaning of the tooth canal working from the crown area. Now the root tip is cut and removed. Next, you see another instrumental root canal cleaning. The area is repeatedly flushed with special solutions in order to remove tooth particles and tissue residue that were cut off during the grinding process. Lastly, the canal is dried with a paper tip, and the clean canal is filled with sealing cement again. However, it's important to note that the cement contracts during the hardening process and potentially creates subsequent microfissures, which would be potential entry points for bacteria. So the cement is kept as thin as possible with the help of a bar. Here, the bar is pictured in red. A narrow cement gap means less contraction and, therefore, smaller leakages. The root tip itself often branches out into several single canals. By cutting the root tip, all non-refillable side canals, seen blinking here, are removed, and therefore has only one cleanly filled main canal remaining. The inflammation origin is also removed. Sometimes access from above is not possible, for example on pivot teeth, or if a root canal instrument is chipped and stuck in the tooth interior. Using the retrograde root tip resection, the tooth can be cleaned and sealed from below, meaning from the capped root tip.
Root tip resection with retrograde filling refers to the surgical removal of a root tip and the cleaning of the tooth canal from below. It is also referred to as a retrograde apex seal.
An alternative to this surgery would be tooth extraction. The risks associated with root tip resection are negligible if it's performed by an experienced surgeon. However, there can be complications in isolated cases that may require additional measures to be taken. Any additional measures that are required can then lead to further complications, and those can eventually be life-threatening. For our purposes, we will only discuss root tip resection-specific complications. These include bone inflammation or osteomyelitis, damage to neighboring structures such as the tongue, cheek, nerves, blood vessels, neighboring teeth or roots, and related consequences such as sensation disturbance in the tongue and/or lips. Wound infections, sinus cavity openings that can lead to sinusitis as an additional consequence. Inflammation recurrence after surgery, and incomplete resection or overlooking of roots and root parts. Happily, such complications are very rare today because of positive medical developments over the last few decades.